Hey guys, we're on a roll here, so let's keep riding the wave of the autonomic nervous system. We got a little technical. I'm really excited by that stuff. I kind of like it. So we're in chapter 15, lecture 4. I gave you guys a couple short ones instead of making it be one big long one. And I'm having fun with this stuff because it's like, what's going on with your body and why? And even with the last lecture, how can you manage it? Well, maybe not you so much. Well, actually, we're going to talk about that. That would be biofeedback training. I don't know how to really do that, but I try to force myself to breathe at normal rates when I'm all worked up. I have to get the trusty rusty pen here. So, let's see what we have left in this chapter. We've talked about how it works, why it does what it does, how I can trick it if I really wanted to by using medication, looking at all my little hair sticking up. Moving on. So we're now going to say, okay, what does the sympathetic nervous system do to organs versus the parasympathetic? And they're usually antagonistic, not working together. There's one situation where they are cooperative. And then how is it controlled? Like who is kind of the boss? We already know who the boss is. It's the hypothalamus. So let's see what we get out of this next lecture. So moving on. Okay, sympathetic versus parasympathetic. Oh boy, I don't even want to look at this. Fight or flight versus resting and digesting. That's kind of what we're focusing on, but we're going to get a little more specific. So the sympathetic nervous system is about making ATP, depleting my energy stores, because you've got to be ready to react. It's going to be increasing your heart rate, increasing airway diameter, getting the airflow in, increasing diameter of pupils, getting the information in. I'm going to shut down the GI tract and the urinary system and shuttle it to like skeletal muscles. And I'm going to just be making a whole lot of glucose for ATP. Parasympathetic is typically opposite. It's about restoring calm and peace and all things slow and wonderful during rest and recovery. I'm going to increase my gastrointestinal activity, decrease my heart rate, decrease diameter of my airways, decrease the pupils, promoting salivation, urination, defecation, digestion, and taking my glucose and getting it to be stored up. Glucose long-term storage is glycogen. Okay, so this is a cool table. I think there's 2 pages. Oh, there's 3 pages. Not that I'm going to read every single one, but we have the sympathetic nervous system and what it's doing versus the parasympathetic nervous system and what it's doing. So the adrenal medulla is only being talked to and stimulated by the sympathetic nervous system. Tears, so that's your lacrimals, your tears, and really getting turned on by the parasympathetic. Let's see, what's the pancreas? The pancreas is going to be getting turned on by the parasympathetic nervous system because it's going to be releasing your digestive enzymes. And it's going to be promoting insulin, and insulin is telling your cells to take in glucose. So that's the parasympathetic versus glucagon is telling the cells to release glucose. The posterior pituitary going to be releasing ADH, which will increase blood pressure and there increase blood flow. This is interesting because the pineal gland is getting activated to release melatonin in the sympathetic nervous system. I gotta think about that one for a little bit. Okay, sweat glands are turned on by the sympathetic nervous system. The liver is telling it to increase glucose. We're just going to kind of leave it at that. Parasympathetic is telling it really to decrease the glucose levels. All right, let's see some other ones. The heart. Sympathetic nervous system will increase heart rate. Parasympathetic will decrease heart rate, right? So they're antagonistic, right? A whole lot of these are urinary, respiratory, a little bit of digestion, and then the urinary. Oh, my crazy kitty cat wants to come in. When it comes to the iris, the sympathetic nervous system dilates the pupil. The parasympathetic constricts the pupil. But it's interesting to note that it's two different muscle sets in the iris for this to happen. Look at this is kind of cool. The erector pili muscles are stimulated by the sympathetic nervous system, giving us goosebumps. Oh, I guess there's probably a drug to prevent that from happening. We'll talk about the sexual response in a little bit because that's actually cooperative. Okay, in the vascular smooth muscle, so that's smooth muscle in, well, glands and blood vessels. The sympathetic nervous system is constricting them all to decrease urine, to, vasoconstrict in abdominal viscera. Oh boy, let's not go too deep into this one because some things are getting dilated, some things are constricting to alter blood flow, right? I'm reducing blood flow to the skin and I'm increasing blood flow to skeletal muscles. Okay. So the other wacky thing, I feel like I should put this on the test, I never do. That's a good test question, is the parasympathetic response. Right? The parasympathetic response is short-lived, very local, because I have that acetylcholinesterase to break it down. And the sympathetic nervous system is longer lasting and it's body-wide. It's body-wide because the adrenal medulla is dumping norepinephrine into the bloodstream and it's going everywhere. And that's a bummer. So that's one. And two, it's just inactivated a lot slower. There's no enzyme. It gets broken down by the liver. When it gets to the liver will break it down. It's not pretty. Oh, ew. Okay. So what you typically have is your kind of one is controlling the situation. You're not both sympathetic and parasympathetic controlling, and it's regulated and controlled by the hypothalamus. A few things are only ever managed by the sympathetic nervous system, so that's your sweat glands, the erector pili muscles in your skin, your blood vessels, and the adrenal medulla, and I guess the kidneys and the spleen. There's no opposition, so it's either turning it on because it's activated versus it not being in sympathetic nervous system mode. Excuse me. So the sympathetic division will control blood pressure. So blood pressure is always being controlled by my sympathetic nervous system. And by managing blood vessel diameter. So I manage blood vessel diameter. Learn about that in the spring. Is how typically I manage blood pressure. Right? There's a couple other strategies, but we're going to talk about those in the spring. If these blood vessel, smooth muscle contracts and constricts, it's going to increase my blood pressure. If they're not needing to be freaking out, then they're just going to go back and open up, which will decrease the blood pressure. Oh, look, here's a little medication. So there's a drug that will force them to vasodilate. And that's a way to manage high blood pressure. So parasympathetic nervous system mode typically is in control of your heart, your digestion, urinary, and other glands. So typically it's slowing the heart, and it's because it's a vagus nerve, it's known as vagal tone, because the parasympathetic nervous system controlling the heart. And that gets overrode, right? Thrown out the window if it's time to freak out. Drugs that block the parasympathetic nervous system responses can also affect the heart rate and cause you to retain your urine and your indigestibles. So they're antagonistic, right? They have opposite effects of sympathetic and parasympathetic. There's one situation where they work together and it's cooperative, and that has to do typically more so with the male genitalia, even the female. So you have to be in parasympathetic mode in order for erection to happen. So you got to be kind of relaxed and chilled out. And then what happens is there is some trigger. I don't know what the trigger is, but the trigger will trigger you from parasympathetic mode to sympathetic nervous system mode, which will cause ejaculation and contractions in the female vagina. So what is the trigger from parasympathetic to sympathetic? I don't know that I want to study that, but if you can control the trigger and you don't switch over so quickly, then you can have a lot more fun before the party's over after ejaculation. Just throwing it out there. Very interesting. It's just kind of fun stuff. So the sympathetic nervous system division has some roles that are uniquely theirs, and I think we actually already talked about these because we said the adrenal medulla, the blood vessels, erector pili muscles, and kidneys and sweat glands. So the sympathetic nervous system controls your body temperature, blood pressure by controlling renin, and the metabolic rate of the BMR, the metabolic rate of the cells. So I just want to see the quick thing. Okay. So when we talk about it and we say, well, who's kind of in charge here? And it's the hypothalamus. The hypothalamus is going to, well, let's hold on. First we have spinal reflexes, right? Urination, defecation, erection, and ejaculation. Those are all just existing in the spinal cord. And we have the brainstem, including the reticular formation. That's going to manage your heart rate, your blood pressure, your respiratory rate, and depth, pupils, salivation. But that's going to be told what to do by the hypothalamus. So while these structures are actually, sending out the motor neurons to talk to the effectors, they're just the middleman, because it's the hypothalamus that's going to be talking to them, telling them what to do. And the hypothalamus will get an emotional input from the limbic system, will get information from your senses of your cerebral cortex, to help it in its decision of, am I in sympathetic nervous system mode or parasympathetic? I just think that's kind of cool. So let's see, the hypothalamus, the brain stem regulates functions directly, right? So that's a big word there, directly manages it. Respiratory centers in the brain, in the medulla and the pons for control of respiration and other spinal reflexes. The hypothalamus, however, oversees all of these activities. Remember, it has a little blood-brain barrier, so it can be monitoring the blood and seeing what's happening, as well as the input from the limbic and your emotions and the other senses and motor inputs and communication with the cortex. So I have the hypothalamus managing, what was that? Blood pressure, body temperature, endocrine activity, emotional states, and whether or not I'm going into sympathetic nervous system mode. So, but I have inputs where memories, so the cortex, can produce a physical response. And we're starting to try to use that, where we try to consciously, voluntary cortical control over involuntary activities. And that's what this biofeedback training is. So this is kind of cool. And this is our last little concept. So it's used to treat migraine headaches. I should have been doing that a couple weeks ago. Manage stress and can reduce risk of heart attacks. So what you have is you have a subject, a person who has one of these health crises, trauma, disorders, and they're connected to a monitoring device that will detect what's going on. So maybe sometimes one psychologist was telling me the patient holds a thermometer and they look at the temperature on the thermometer and they try to alter, control their thoughts, concentrating on calm stuff, pleasant thoughts, to increase the temperature that's being displayed on that thermometer. Right? So that's when they try to alter body temp. And now heart rate, put you up to a heart monitor and you hear it, or you see the numbers flashing and you're like, okay, 100 beats per minute. Let me try to physically lower that so voluntarily cortex involved to control those involuntary outputs. I just think that's cool. So, well, that's all I have to say about that one. What's this? Do we even want to talk about this? Oh my gosh. I'm not going to ask you about this stuff because that is good stuff as it is. This is just talking about a reflex arc, but it's, we already had the reflex arc that we talked about in lab. So we have the somatic reflex arc, which is just a one motor neuron chain. And then we have the visceral reflex arc, which is a two motor neuron chain to an effector of smooth muscle, cardiac muscle, and glands. Oh yeah, your book had some interesting things to talk about with some disorders. Well, we're going to go into hypertension next semester, and we can manage blood pressure by managing blood vessel diameter. We can manage blood pressure by managing heart rate. We can even manage blood pressure by managing blood volume. So there's a lot of different ones. And it's, blood vessel diameters to prevent the vasoconstriction. I want to talk for a second about this Raynaud's. I don't know if that's called a disease or a disorder, either any one of those, but it's just super exaggerated vasoconstriction in the fingers and the toes. So their hands are pale and they can be very painful. So they have to take care that they don't get frostbite and have some serious tissue damage in their extremities because they have such a vasoconstriction. So that would be treated with vasodilators. Here's another imbalance of the autonomic nervous system. It's called autonomic dysreflexia, and it's uncontrolled activation. I'm just reading it, right? But it's with people who have spinal cord injuries and quadriplegics where their blood pressure takes off because it gets into this loop of activating sympathetic nervous system response, and they could die from that. So I think that's kind of crazy. And I guess I don't really need to be chatting about this because we're done. That is woohoo. Now I'm like in the shade, I'm in the sun, I'm not sure what's going on. That is chapter 15. So I broke it into 4 lectures. a little bit shorter bites. I don't know, it just kind of empowered me to keep charging on. And, you know, we only have one more chapter after this one, and the last chapter is actually kind of a long one. So enjoy the short one. I hope you had fun with it. It's our last nervous system chapter. We're finally leaving that area of the body. Yay. It's always a long ride with the nervous system. No, go away. So I hope you guys are doing okay out there. I know some are and I know some aren't, and I'm sorry for those that aren't. It's been a really tough semester for everybody. And just take it one day at a time. You do your best. That's all you can do. So remember that. If you gave it your best, that's all you can say. And you have to, you know, you maintain your integrity and your respect by saying, I did my best. And that's where the respect lays. So good luck. I will see you on the next recording, but not really. You'll see me. Okay. See you later. Bye.